Hi, this is Bella Mehta from New York, reporting for Room Now at ECR 22. I wanted to talk about an interesting abstract that I came across and a question that clinically comes across a lot. So the abstract number is 0872, and it is about incidence, risk factors, and outcomes of eosinophilia on IL-1 and IL-6 inhibitors in systemic JIA and non-systemic JIA patients. So we know that a lot of SGIA patients are exposed to biologics, IL-1 and IL-6 inhibitors mainly. They're almost the first line sometimes. And some of these patients may develop eosinophilia. It is thought to be associated with HLA-DRB115XX allele. They may also present with a typical rash. It is unknown if this leads to MAS or lung disease in SGIA. In SGIA, lung disease right now is a big conversation at the ACR and in the field because that is typically one of the worst outcomes. So this group performed a retrospective case control study with SGIA as the cases and non-SGIA patients as controls and looked at incidence of new biologics. So thus they had 240 new drug exposures in around 75 SGIA patients and around another 100 or so non-SGIA patients. 49% of these patients with SGIA were positive for the HLA-DRB115XX allele. Thus, this seemed to be very common in this cohort. And this was done either for clinical purposes and some of it was for research purposes. And what they found was that IL-1 and IL-6 exposure to drugs did increase eosinophilia. So that was correct from a hypothesis perspective. And the eosinophilia increase was not only in systemic JIA, but also in non-systemic JIA. So, it was common in all forms of JIA after the biologic. So when they did the chart review, they found that a lot of these patients, after seeing the increased eosinophilia, were switched to another agent, another drug. And commonly, the switching caused flares and increased incidence of MAS. What this basically says is just seeing an increased eosinophilia may not encourage you to switch biologics or switch medications immediately. The whole clinical picture needs to be looked at. Also, severe disease activity was associated with eosinophilia in ILD or interstitial lung disease in SGIA patients, and thus disease control is absolutely essential. And I think one of the last key points that they make here was that SGIA patients on IL-1 or IL-6 agents, the only significant predictor of eosinophilia was MAS prior to starting the treatment. So there was something different biologically in these patients. They had MAS, they were probably sicker, which caused them to get eosinophilia after IL-1 and IL-6 exposure. I think this is an important clinical study because, obviously seeing all this literature sometimes makes a knee-jerk reaction of switching biologics the moment you see like 1 or 2 reads of eosinophilia above 500. But this study encourages you to look at other factors before switching because having flares is probably the worst case. And especially flares where you get MAS, often that which are life-threatening. So with that, food for thought, I would leave you guys and follow me for more content at Bella_Mehta at Room Now and at Twitter.